Okay, so the recording should be going, and so we are ready to start. Well, thank you for clicking on this exciting webinar today. We are really happy to bring Sarah and Kelly together to talk about different aspects of military SART or military civilian collaborations as part of the SART Toolkit. In the SART Toolkit, you can find a ton of written information about military SARTs in Section 6 under Systems-Based Communities. So the military as itself is a system that has specific rules that Kelly and Taylor are going to jump in now. And in the toolkit and in the text of the toolkit, there are brief explanations of various aspects of what Sarah and Kelly are going to talk about today. And then there are also a lot of resources and different agencies that you can connect with for more information and a little bit of a deeper dive as a nice complement to what we'll be discussing today. And Sarah and Kelly, do you want to do intros for yourselves?
Sure. Go ahead, Sarah.
Okay. Hopefully everybody can hear me well enough. I'm happy to be here and glad that Kelly's able to join me and Christina, or Christine and me, right? My mom would be upset about my poor grammar there. To talk about military sexual assault resource teams and the collaboration between those SARTs and those within the local civilian communities that are affiliated with military installations. So I was a judge advocate in the Army for 12 years and a special victim prosecutor and defense counsel, and just have well over a decade of experience prosecuting and defending sexual assault cases within the military as well as the civilian world. Now I'm a civilian defense counsel, so I still deal with military cases and sexual assaults on the military and civilian side. So I'm happy to be here and provide, some guidance and expertise from my perspective. And again, happy to have Kelly with me, who is a friend and colleague. And thank Christina for inviting me to share in this experience.
Wonderful. So yes, I'm Kelly Taylor, and very excited to be part of this as well. I've worked with Sarah for many years, and we've had a wonderful collaborative relationship from the medical perspective and the legal perspective, which is a very important relationship to have as with all the disciplines. I have been a registered nurse for the past 17 years. Emergency and trauma medicine is where I got my start. So that's a very natural flow into the forensic nursing world, which I have been doing for the last 10 years. I do program management with the military and work very closely with a military civilian SART team for a large installation with the military. I also do teaching and training with all the different disciplines: law enforcement, medical, advocacy, attorneys. So it's a very important collaboration, and it's very important to have the team get to know each other prior to needing to work together, because it only enhances the relationship when you already have that history with the other disciplines. It allows the folks that we're providing services to feel more comfortable with us as a group, because though we know that we're different disciplines, to the patients and the clients that we are servicing, we're one system, we're one process. So if any one of us has a stumble or a misstep, it's kind of a stumble or a misstep for all of us. So it's kind of we share the success and we share the missteps together. So it's really important that our relationship is tight to make this a better journey from kind of traumatic situation to survivorship.
Thank you. So Sarah,
okay,
can you?
I can jump in here. So I think the first thing to start off with before we do the deep dive into military SARTs and the collaboration between them and the civilian SART or civilian providers or responders is just to talk about generally the military's response to sexual assault, unless you've lived in a dark cave somewhere. Most people are aware of the spotlight that's been on the military's response as well as prevention efforts with respect to sexual assault and sexual harassment over the past few years. So to that end, one of the initiatives has been to encourage the creation at the installation level of sexual assault response teams in order to ensure that the military's response and certainly the local response to service members and family members and any victims or survivors, and I'll use the term interchangeably, is up to par to what it should be, right? So that we're providing care and support as needed in our response efforts to survivors and victims. So within that, you have different services. So when we say military, we're talking about Army, Air Force, Navy, Marine Corps, Coast Guard. You also have to keep in mind that you have the active duty component for each of those services, as well as reserve component and National Guard component. And the rules or the policies and procedures that govern the different responses, the providers, the roles that people have within each service depend upon the service, as I said, as well as the status, of the person who is seeking the support. So first and foremost, the military wants to prevent sexual assault and also provide response efforts that are coordinated and that meet the needs of the people involved. So it's important just to keep that in mind as we start, and we'll get into a deeper dive as to who the different players are within the military system as compared to the civilian system, and then obviously the differences between the composition of a military SART and a civilian SART. So to that end, looking at the next slide where we're talking actually about the composition of the military sexual assault response team. So even on the civilian side, you're going to have, there are going to be parallels between the two. You're going to have law enforcement involvement for the most part. Kelly's going to talk later about within the military we have the option of restricted or unrestricted reporting. So involvement of military law enforcement personnel is going to differ based on the type of report that the survivor makes. And but again, she'll talk about that a little bit later in greater depth. But for the most part, there's going to be parallels. So you're going to have law enforcement. Each service has a military criminal investigative division. So within the Army, it's CID. Within the Navy, for example, it's NCIS, and there was also, yes, a television show to that effect. There was also a television show about JAGs where they flew around in fancy aircraft, and I've never done that. I've flown around, but the aircraft wasn't fancy. And people weren't nearly as good looking as they were on the show. So just thought I'd throw that out there. But so you've got law enforcement responders, and within the Air Force, that's the Air Force Office of Special Investigations, so OSI. So it's just, they're similar, but they go by different names, but they are law enforcement agencies. And same is going to be on the civilian side, where you've got, county, city, state, federal law enforcement agencies that will be involved. You also are going to have a legal component or legal representatives on a military SART. Within each branch, the terms may be different, but the roles are going to be the same. So, for example, in the Army, we have special victim counsel. Their terms a little bit differently in other services for the same legal representative. So these are attorneys who are in the military but who represent the best interests of the victims, whether that's an adult or child, as long as they're eligible for services. We won't get too far into the weeds on that, but you're going to have that person. You're going to have a special victim prosecutor, most likely. That's the term that the Army uses. Again, other services use different terms sometimes, but you've got the special victim counsel, special victim prosecutor. The special victim prosecutor is representing the government's best interest, and that is the attorney who's going to oversee the prosecution of the offense. You may have a trial counsel, and that's going to be the attorney who works closely with the command, also a prosecutor. So that person may be a part of the military SART as well. You may have all three that are members of the SART. You're going to have various medical providers, just like you do on the civilian side. So you're going to have your sexual assault nurse examiners, sexual assault forensic examiners, so your SAFEs, your SANEs, whatever the term is used. And I've seen all kind of different terms across the board in the civilian community and in the military. So you're going to have those providers, those first responders, and also the ones who perhaps provide follow-up care. You're going to have, we'll come back to military commanders, but on the same level as medical providers, you're going to have the behavioral mental health providers, so counselors, therapists, psychiatrists, psychologists, some representative from a behavioral health clinic within that military installation. You're going to have victim advocacy personnel, so that may be a sexual assault response coordinator for the installation. It may be a victim advocate. It may be both. You have representatives from the installation. There are also personnel who serve directly at units and provide services directly to units, and then you have the installation level. And also, you're going to have representation, which Kelly will talk more about later, from the civilian community on your SARTs, depending on what your relationship is and how large the civilian community is in relation to the military installation and what agencies on the civilian side are in existence within that community. And so there may be representation of those folks on the military SART. You're also going to have commanders. So in the military, the commanders oversee the military justice process. They are responsible for everything, really, from the legal perspective and law enforcement to medical care and behavioral mental health services. I mean, ultimately, they have to ensure, and they're mandated to ensure that the system works the way that it's supposed to, that all policies, procedures, and statutes are followed, to ensure that victims are cared for, services are provided the way that they're supposed to, and that prevention and response efforts are in line with congressional mandates and the individual services themselves in terms of the policies and procedures. So you're going to have a lot of command involvement throughout the process of a case or an investigation, and they're also going to be part of the sexual assault response team. And then you will have other providers or responders as needed, meaning whatever the particular makeup is of your installation or base or post, you know, who is providing services, what are the collaborative relationships or partnerships that are in existence or that you create over time, and representatives from other organizations, whether within the military or the civilian community, you know, they will be a part of that. So you may have family advocacy, which is a military program. You may have representatives from there. You may have representatives from local rape crisis centers on the civilian side, or medical facilities on the civilian side, or hospitals, clinics, whatever it may be, depending on the size of that civilian community, and then again the relationship and what are the cases like that tend to come up. And so to that end, I'll throw it to Kelly to talk about what more specifically makes a military SART unique, and then obviously anyone jump in with anything you'd like to add to that.
Sure. So some of what makes a military SART unique is the fact that you do include your civilian entities, if possible, because there's a lot of joint jurisdictional issues. Assaults may be occurring within the community, but involving service members or dependents. So there may be issues where local law enforcement may take the lead on an investigation, but the military law enforcement is still an active part of that as well, because of their role with the service member. So it's really important to go ahead and include those local rape crisis centers. Also to consider including other resources that they may have for victim services, maybe the leader of a support group, or certain communities may have very specific therapy methods. I know some communities do yoga or horse therapy, including kind of some of those outside agencies too, because they can bring a lot of really good input, outside of the box thinking, and also can provide free assistance to military members and also to family members. Don't forget that when an assault occurs, it doesn't just involve the person that has been assaulted. It's also ripples through the family, can ripple through a unit. So it's really important to remember some of those agencies that also provide support to families, because family therapy, family counseling, things like that can be a really important part of the recovery for our survivors, because sometimes when family members or friends don't exactly know how to support a survivor that's been through trauma, it can cause friction within the home environment, which then doesn't put doesn't lend towards that journey to survivorship. So that's really important to remember some of those kind of out of the box agencies as well too, including your DA's offices, things like that, bringing those folks to the table, just so that you have a really well-rounded position, so no one's left out. So then you kind of cover all of your bases, and remember to include not just maybe the primary agencies. For if you're on an installation, most installations have that city right outside that's going to kind of be your primary area, but also including some of the surrounding counties and the surrounding cities that branch out a little bit further, that may not actually have very well established programs, because they may not see sexual assault very often, and they may not be interfacing with the military as frequently as the large city outside of the installation. So it's important to draw them in too, because sometimes our military members don't live right outside the city or live right on base, so they're living a little bit further out. So it's really important so that they feel that they're supported in their own communities. And then it's nice because the military has so many resources that sometimes these smaller jurisdictions don't have. So it's nice to bring them in to do joint training with us, because the military is very fortunate that we do a lot of training, we do a lot of education, and some of the smaller agencies can't afford to do that, or can't afford to send their staff and their folks out to these larger trainings. So if include them in to that, not only that SART group, but also to any trainings you may do, and do cross training with them. That's a good way to find out about some of our military members that may be receiving services that we were not aware of. So it's not only beneficial to them to get that education and training to make everyone better, but it's also a good way for the military to stay connected to the community, that they may be getting services from. So it's a good cross relationship to have. So don't forget about those smaller agencies as well.
Yeah, I agree. And Kelly, I know the size of the installation where you currently work, and also, in your experience, what are some of the challenges that you've seen, in providing services, whether it's a civilian survivor or maybe a military survivor who's not an active duty soldier, and coordinating sort of services between the military and the civilian community?
Sure. So we've had situations kind of go both ways. We've had service members or their dependents that have initially made a report to a civilian hospital, to a civilian law enforcement agency, reached out to a local rape crisis center, and they've received all those initial services on the civilian side. Maybe proximity, maybe lack of understanding about the resources that the military has. For whatever reason, they have reported to a civilian hospital, to civilian law enforcement and advocacy services. That's perfectly fine, but that's why having that relationship is really important, and establishing that, because the military has excellent follow-up services as far as medical and behavioral health resources that sometimes may be more challenging to coordinate on the civilian side, depending on where you're located. But the military stays pretty consistent throughout the services, the branches of services, with what kind of follow-up care they are providing. There's a good system set in place that's pretty consistent. So it's nice if that relationship exists between the military and the civilian community, which is typically occurring through a SART team. It's nice because then those folks needing the services can be referred back to the military installation to get those. They can be given at the hospital. They could be given discharge instructions through, from the military hospital that has the point of contact for the sexual assault care coordinator to make those medical follow-ups. Just a way to kind of draw them back into the military community if that's what they choose. The flip is possible as well too, where they receive all of their services through the military, and they get follow-up care through the military as well, but maybe they need more specialty care. There is a possibility that working with the military providers, that referrals could be made off post to civilian providers based on specialty care needs, and that's something that the military providers could work out through a referral system. But having those relationships between the civilian community and the military community is vital to understand how, when folks need more resources or different resources, who to call, who to contact, and kind of establishing the providers that you're using within the community and the military.
Yeah, no, I would definitely agree with that. And have you encountered, issues where I know you sort of touched on if there are services provided on the civilian side as well as on the military side. Do you have examples of situations where you've worked with civilian agencies, I guess, maybe local rape crisis centers or other service providers, to provide support or aftercare?
Absolutely. That's pretty common. Also remember that these rape crisis centers, counseling services, they can actually respond to the military facility, the hospital that they're receiving treatment on, because sometimes people want civilian advocacy, or sometimes they want additional advocacy, or sometimes we may be dealing with a child and they need civilian advocacy. So there's lots of reasons that those relationships may kind of cross over. And yes, we very frequently, we're never going to limit the amount of resources. If someone needs, wants assistance from the military, but they also want to do maybe a support group through the civilian side, that's pretty common. To get maybe follow-up behavioral health care through the military. However, the community offers a support group or, some kind of different resource, like we kind of discussed earlier, the yoga or something like that, like a different outside resource that the military may not have. That's something that we can kind of link them into, but we have to know about it first in order to offer it to our folks. So it's really important that we stay in tune with what the civilian communities are offering. And a great way to hear about that is to invite them to our meetings and to kind of find out what they have going on. And so then we can offer those as resources to our patients when we see them.
Yeah, and I think that's a great point. And I know there's a slide, the next slide we sort of list what are some, who are some of the people who provide support to victims and, who may also be a part of the military SART composition. But the next slide beyond that talks about collaborations, which is what you were speaking to with regard to building those relationships with civilian entities and military entities. The military has so many great services and programs available to provide support to survivors and their family members, and I think it's phenomenal that you included the family members not just as survivors who need services in that respect, but also because they are dealing with the aftermath, right, of an assault, a very traumatic event that affects not just the survivor, but also the family members and friends of a survivor. So a lot of services are available within the military community if there's a military connection for those people who provide support, but also within the civilian community. And it all comes down to relationship building. Even if a military service has some guidelines for setting up a SART, or, the National Sexual Violence Resource Center, we can publish the guide and sort of talk globally about building collaboration. But at the end of the day, there's not really a guide needed for you to reach out, introduce yourself, and start a conversation. And when you start to do that, then you learn what resources are available. Hey, what training are y'all doing? Is there information that we can share? What services are provided by your group that we can also share in? And I think that's a big deal, and that's not always done. And so I think that's probably the biggest tip or most helpful tip, is to find out within your local community what services and agencies provide support or respond, and then within the military installation that's connected to the local civilian community, find out who provides the victim advocacy services, find out who the SANEs are, right, or the folks within the medical community and the behavioral health community. Find out or make the connections with the legal personnel. Find out who the special victim counsel are for that installation, or the special victim prosecutor, and work to establish those connections and then build from there. And I think, Kelly, a great example, because I want to be your number one cheerleader, because we worked together forever, and Kelly's amazing, is to talk about you actually did that. It's sort of stepping a little bit outside of the SART, except for those collaborations then feed into the sexual assault response team. But you started an annual summit that brings together and that can certainly help to establish these relationships and build these connections that we're talking about are needed for a successful SART on the military side and the civilian side, and that is you have a special victim summit that is held every year at Fort Bragg. So, and I know that it grew out of this need to bring unity and attention and education to sexual assault prevention and response.
Absolutely, and I think it's such a phenomenal thing, and it just started with such a small idea several years ago of just kind of bringing a SART together to the table to get some education together, because I feel like not only should we be having these conversations together, we should be training together, and we should be getting the same information together, so we're all hearing it at the same time, and then that allows us to grow together. So we're not growing at different levels. We don't have this phenomenal group of law enforcement agents with nurses that are struggling, or vice versa. So you want to grow together, because if you grow together, you grow your community together. And that's what's really important. You don't want to leave anyone behind. Well, in order to not leave anyone behind, everyone's got to be at the table. So this summit did start as a way to bring everybody to the table, and it's grown into just a phenomenal monster of a thing. And it's, we provide, and Sarah is the MC for it, so I'm sure that's what brings everybody back every year. But it's, the thing about it is I don't think we have the the market cornered on groundbreaking information. We're bringing the best practices and new education every year, and phenomenal speakers that are passionate about what they do. But I think what grows it so large every year is that our community is hungry for relationships. We are, sometimes when you deal with sexual assault, you feel like you're on an island. And when you look around the room, and to the left and the right of you are advocates and attorneys and law enforcement and nurses and just our entire community, behavioral health, everybody's sitting there hungry for the relationship, hungry for the knowledge, because at the end of the day, we're passionate about what we do, and we want to do it to the best of our ability, and we want to do it together. Even though we have different paths that we have to take, we really have the same general outcome of what we want. And so it's really important to be at the table, to have the conversation together, to not get the information second or third hand. So it's really important that we're doing this together. And I always joke and say, no one wants to make a new friend at 3 o'clock in the morning. Our cases don't come in during business hours all the time. They come in on weekends at 3 o'clock in the morning. And to have that relationship already established is vital, and it makes a huge difference for the person that is making the report, that has the courage to come forward and to say, this is what happened to me and I need help. You can see from a nursing perspective, I have a very unique role that I get to see a lot of different pieces of this puzzle. And so I feel very, very blessed and very fortunate to be able to provide services to people at some of the darkest times in their life. I feel it's a privilege to do this. And I have such respect and admiration for my colleagues in all their different disciplines, because we all have a hard road to walk, and we hear a lot of stuff, and we see a lot of stuff. We see a very dark side of life, and we have to have each other to kind of lean on to get through that. And having that relationship established ahead of time is, like Sarah said, it's vital. It has to happen. When I walk into an emergency room and I see a patient sitting before me that's terrified and frightened and doesn't know what's happening and doesn't know what's going to happen and may not know exactly what happened to them, and there's a victim advocate sitting in that room that has already established that rapport with that patient. If I walk in and I already know that victim advocate, and that's a good working relationship, you can almost watch stress and tension just leave that that victim that's sitting there in that seat, because they understand that this is a team, that this is not one person that's going to help them. They now have two people that are going to help them. And then when law enforcement, if it's an unrestricted report, walks in the door and that relationship is there, and I say, hey, this is a great agent, this is a great detective, I work with them all the time, that eases their worry some too. Okay, now I've got 3 people on this team. Same thing with Special Victims Counsel. Or VLCs for Navy. It works all the way through every discipline that they're going to come in contact with. If you have that established relationship and you give that warm handoff at every point, that is only going to make our process better, which is only going to make this journey better for this person. For us, yes, we all have a ton of cases. We have, unfortunately, a ton of cases that we see and that we deal with. But to this person, that's everything at that point, and they deserve to have our everything as a team. So I cannot echo enough what Sarah says about those relationships.
Yeah, I would agree, and I think at the end of the day, the goal for a SART, whether it is a civilian SART or a military SART, and quite frankly, I'd prefer it just be a collaborative SART, as opposed to, putting it in a box and saying, well, it's military, it's civilian. SARTs are designed to be coordinated bodies that include victim advocates and law enforcement and medical personnel and prosecutors. I mean, they're meant to be multidisciplinary teams that are able to meet and respond to victim needs, work through, offender accountability, community safety, obviously is a part of what their focus is, and whether it's formal and everything's written out with guidelines and responsibilities and duties and that sort of thing, or whether it's a more relaxed, informal structure, it doesn't matter. I mean, the point is that it be formed, that people work on building these relationships so that there is a team that is committed to ensuring that needs are met, services are provided, and that education and training opportunities for the professionals and service providers as well as the community are in place, and that the more diverse and multidisciplinary your team is, the better off the community is going to be in the short term and the long term. And I just go back to, it's all about talking and building relationships and just reaching out, and it truly does naturally happen from that perspective. And then you're able to learn more specifically about the military system as compared to the civilian system, which we can't obviously get into, a deep dive into the military response and the judicial process within the military justice system and the medical community and all that. That would take forever. That would be a series of webinars. But I think that our message is that reach out, build those collaborations based on your local community and the military installation, that serves that community, and build it accordingly. And if you build it, they will come, right?
Well, and I think the important thing too is, remember, you can make a SART what you want it to be to fit your community's needs. We found good luck with, we all have so many meetings about meetings. And what we found is participation was hit or miss. So we kind of thought a little bit outside of the box, and we made it every other month, and we made it a lunch opportunity where everyone got together at a specific location on a Friday at noon, and we have amazing participation because, you sit down and you have lunch together. You learn about each other. You learn about each other's families. You really learn about the person sitting next to you from different agencies that you may never interface with otherwise. But I guarantee at some point at 3 o'clock in the morning, that person's going to come walking through your door, and it's great to have that relationship. You'll get so much further. So it doesn't always have to be a meeting at 9 o'clock in the morning on Monday morning. It can be what you want it to be. And we've had great success with doing a lunch. People come, we get unit representatives, which is nice because then we find out about what's going on in each specific unit. They're able to put out events that they have coming up, and then we're all able to go participate in those unit events that are sponsoring, sexual assault prevention, or their fun runs, or their fundraisers, or whatever it may be. It gives them a forum to say, hey, I'm the representative, I'm the advocate, I'm the JAG, I'm whatever from this unit, and hey, this is kind of what we have going on this month. And you know what? It's been phenomenal. What we find is that when we then show up at these events, it's our SART. So we have almost like these impromptu SART meetings at these events to support each other. It turns into not, I'm obligated to go to this meeting. It turns into, I'm a community and I'm going to go support that unit, and they're going to turn around and they're going to support me. So you can make it what you want to make it. We've had great success with that. So I would almost recommend, maybe starting at that, and maybe there's 5 people sitting at your lunch table the first month, and then people like it and they bring another colleague, and then all of a sudden you've got 5 people from each discipline sitting there, and the word gets out and people really, they enjoy it and they look forward to it. The other thing I was going to mention too is why it's wonderful to have these relationships is, nothing is always going to run 100% perfectly and smoothly every single time, but it's our goal to always reinforce best practices and to discuss them and bring them to the table. And having these relationships with other agencies is a good gut check for your own agency, because sometimes it's hard to take an honest look at the program or the unit or what you have set up. And so it's nice to have those relationships where people can come in, maybe advocates can come into our hospital and say, hey, I know this is your vision for how your program's supposed to work, but when I was specifically in the hospital with a patient, this is what happened that kind of deviated from your vision, and I just thought you'd want to know, as opposed to a bad encounter, a complaint about an agency, because those relationships don't exist and they don't understand your vision and they don't understand your passion or how it's supposed to go. And so getting that feedback, kind of looping back, or or a nurse maybe saying to law enforcement like, hey, listen, this, we had to sit here maybe with this kit for a really, really, really long time. What's your feedback on that? Maybe it was that honestly they were caught up with other investigations, or maybe it was, just a gap in the system. But identifying those gaps is really, really important to tightening up our procedures and our policy to make everything better. But sometimes without that real genuine feedback from other agencies, if we operate in a silo, we're never going to be better and we're never going to expand. So having an opportunity through those relationships to welcome that feedback, and the feedback to not come in the form of a complaint, the feedback to come in the form of genuine program improvement from colleagues that care about your program just as much as you do, because we realize we're all in this together, is really, really valuable, and it only makes each one of us better. So I would encourage that feedback after. I loop back around with all our folks after and say, how was the encounter with our discipline? How did that go this time? And that is actually how I've made some of my best program improvements, is from the feedback of our attorneys, advocates, and law enforcement.
Yeah, I completely agree with everything you said, for once.
For once, I finally got her to agree.
Well, and those lunches and SARTs that you talked about, they're fabulous. I went to a couple. So, yeah, I would agree. But, Christina, do we want to throw it back to you? I know we're probably hitting time.
Yeah, I think there were a couple questions that we had from the listeners that it might make sense to ask, if that works. And you might have covered some of these a little bit during the conversation. I think one of the first one is, I love the idea of relationships. One of the questions that I get asked a lot from the civilian side is who specifically to reach out to in the military? Do they need to start with the commander? Or do they need to, what does that look like? Is there specific advice there, or is it really anyone who kind of answers the phone when they call?
Well, I think you can either reach out to the special victim prosecutor, is always a good start. That's going to be on the legal side within the office of the staff judge advocate. You could also reach out to the sexual assault response coordinator. That's going to be another great person at the installation level who can provide guidance on the SART or whatever it is that your question is, or steer you in the right direction in terms of making contact with a particular commander. So I would recommend through the legal office, the special victim prosecutor, or through the installation sexual assault response coordinator, touching base that way would be my recommendation.
Great, thank you. And I think early on you had mentioned that you would touch a little bit more on what the difference is between a restricted and unrestricted report. And I just want to circle back and make sure that we got to that piece.
Right, so that's one of the, that could be a webinar in and of itself. So without getting too complicated, service members have an option to restrict a report, so to report a sexual assault. If it's restricted, there's not notification to the command of any identifying information. The command would be notified just that, an assault occurred, but not be given specifics about it. And law enforcement is not notified, so there's not an investigation. That's if the report is restricted. That allows the victim to receive services, behavioral mental health services, medical services, and any advocacy services that they may need or want. So that provides access there. If it is an unrestricted report, then the command is notified, identifying information is provided about both the victim and the alleged offender. You are going to also have the advocacy, medical, behavioral mental health access, but you're going to have command involvement and you're going to have a law enforcement investigation. Now, there are, again, I said it can get complicated. Who can report and to whom to report and what makes something restricted, unrestricted, that gets very much into the weeds. I think what's important, for this platform is just to know that there are two different types of reporting options within the military system, and that with one comes law enforcement and command involvement and identifying information, which is going to be the unrestricted report. And with the restricted report, you're not going to have that involvement for the most part. There are exceptions and a lot of little rules. But globally, that's, or generally speaking, that's the difference.
That being said, when you report to a hospital, as far as from the SANE perspective, regardless of the reporting option, restricted or unrestricted, they can still have the option to have evidence collected, all medical care, of course, and then evidence can be collected, and it can be stored under a number that's issued through the SARTs, the sexual assault response coordinators. So just because people elect to not involve law enforcement at that time, changing a reporting option is really not time sensitive. Evidence collection is. So there is that period of time, fairly soon after the assault, that evidence does need to be collected if it's going to be obtained. So it's important that if the patient feels that at any time they may want to change their reporting option, though they do not have to have forensic evidence collected to do so, they can always change their reporting option and open an investigation with or without forensic evidence. There is a limited amount of time to collect that evidence. So we do we do offer that as an option to collect the evidence and then to store it, and then that's done through, through the policies of the hospital and local law enforcement storage facilities. And that's specific to each area, but that there is that caveat that just because they don't elect to have law enforcement or command involved, there are still several options that they are entitled to, all the follow-up behavioral health care, medical care, victim advocacy services, special victims counsel, things like that, that they are still entitled to without an open and active investigation.
Great, thank you both. And I think there is more information about that in the actual text of the toolkit and links to some resources and active military websites so folks can find more specifics, that next level of detail if they're looking for it. I think those are all the questions that jumped out at me for right now. Thank you both for coming and participating and sharing your experience. Giving us some hope that there are some really great collaborations that work really well.
Yeah, absolutely.
Thank you for including us.
Thank you so much for having us. Yeah, absolutely.